Hi, this is Dr. Tom Rogers at Performance Medicine. I really want to sit down and tell you the story about why I formed Performance Medicine 14 years ago. I've been practicing family medicine for about 20 years before I increasingly became more dissatisfied with the way that medicine's practiced. And a lot of it really is not the doctor's fault, it's the system's fault. Increasingly as doctors, especially in the primary care field, we're called upon to spend about 7 minutes with each patient. And in the meantime, we're over on a computer typing away, trying to enter data on you while we're trying to listen out of one ear and try to find a code or a diagnosis for what we think's wrong with you so we can get paid something through the insurance companies. In other words, we're working for the insurance companies, not you. So as time went on, I realized that I was really dissatisfied with what medicine had become. So I decided to get rid of everything that I didn't like about medicine. Number one was insurance companies. Number two was the computer I had to sit typing things out on. Number three, I had to find a code and try to file it, trying to bleed 30 cents on the dollar out of your insurance. And number four, I didn't like management telling me what to do when I'm the doctor. You know, business managers don't know how to treat patients. They need to stick with business, but they don't need to tell me how to practice medicine. So I branched out on my own. Everybody thought I was kind of nuts to do it, but in the last 14 years since I've been doing it, I've become a much better doctor. I have plenty of time to spend with my patients, and I don't try to run a bill up trying to get a part of it through an insurance company. In other words, I work directly for the patient. During that time, I went back and did a fellowship in integrative medicine because I realized that I was piling too many medicines on people when they really needed to learn how to eat, how to exercise, how to de-stress, maybe take supplements and have their hormones evaluated. I became board certified in this, and I'm much more confident that I know what I'm doing now rather than just sticking somebody with a medicine and I label them as a diabetic or a patient with high cholesterol. I feel like I've gotten very smart with doing the proper evaluations in prevention medicine rather than treatment medicine. So it's been a great journey for me. One thing that led me into this whole journey really was two of my children came down with type 1 diabetes, and I realized I didn't know much at all about nutrition. And I feel that most doctors don't have a clue about nutrition. We have a 1-hour class in medical school on it, and what they taught us and what they're still teaching is completely wrong. So I consider myself a relative expert on nutrition. I work to keep people leaner, keep them moving better, and I try to be transparent with all my the cost it takes to see me. It's a moderate cost. I'm very transparent. That's why I do cash. I also have a cash laboratory, or you can file your insurance on laboratory. What's interesting is if you file your insurance, you end up paying a lot more money than if you just pay a small cash price. So I really want to be transparent about what the costs are, and what I've found is that people that really want to get better come to see me. My practice has grown exponentially over the last 14 years. I'm 64 years old. I have no plans of ever retiring because I learn more each day, and I think I'll become a better doctor each day for my patients. So that's my goal, is to help you age in a great way, to where you have energy, you're moving around, your mind's great, you don't worry about dementia, and we make sure that your life is good. We're looking for a quality life. So if you have questions about what we do here or why we do it, visit our website at performancemedicine.net or come into any one of our 3 offices located in Kingsport, Johnson City, or Knoxville. Thank you.